Hi everyone, just wanted to do a quick recap for the reflections this week. You guys did a really good job discussing verbatim, the importance of it, how it provides objective information, it helps to strengthen the chart notes, it helps for future procedures, it helps use like the exact language that the child has heard or that they're used to. So really good job discussing verbatim. One thing I know Chelsea touched on is the fact that everything doesn't have to go in the assessment. So when you're using verbatim throughout a note, as we start doing full API notes, you'll see that kind of the verbatim you use will be stretched out through the note. A lot of the notes this week looked like they were more in a narrative note form as opposed to just the assessment piece. What I'm going to do is post an assessment of the video as we would see it, just an example, not that there's a right or wrong necessarily, but just to give you kind of an example of what it could look like. And then I'm also going to do a full API note and post that so you can see the difference of if a full note was being written, what it would look like and where the information would go. A lot of you spoke about the having a hard time being concise, and that's going to come with time where you figure out what needs to go where and how to describe a situation in a few sentences as opposed to an entire paragraph. That's something that as you practice, as you're in internships, you will learn that, and it gets easier as time goes on, knowing exactly what to put in the notes. So that's going to come. A couple of things I want to just touch about on the video. I know this wasn't really something that was discussed, but a few things throughout the video when watching it. It's a little bit chaotic. There's a lot of people talking. I think it is a great example of maybe advocating for the next time for using the one voice technique. I think it gets a little confusing when everybody's saying different things. There is also a time when he's asking for the IV in a certain place, and I think it can be a little tricky to offer choice when sometimes there's not a choice. So there's very few times that a child can pick where they want their IV. It's usually going to go in the best place where that the nurse sees. So that can be a little bit tricky if a choice is offered when it may not be, upheld. Lastly, there is a point in the video about if it's going to hurt, that it's not going to hurt. They use some words to describe it, but I would say if a child's asking if it's going to hurt, a good technique that you can use if you're there is to say something like, other kids have told me it feels like blank. After it's done, maybe you can tell me what it feels like for you, and let the child kind of take that on to help you and to give him the truth, that because most of the time something is going to hurt a little bit, and when people say it's not going to, it can really be hard for the child when someone's not being truthful, or they feel like it hurts because pain for everybody is different, and typically if a child's telling you something's hurting, it is hurting for them. So just a couple things to note. Chelsea and I are working on the group work, and your feedback will be given directly to the document. So we will hopefully have that back to you by tonight, and we'll turn the community over for the start of the week. So I hope you guys have a great day.